running across for lunch, and with a focus on fast-growing data, AI companies, and focus for the next hour. But before we move on to that, we have some exciting companies coming up in healthcare. And we are now have a medical company platform that offers access to online doctor through video chat, helping diagnostics, treatment, and getting you better quicker. Please welcome VideoDoc CEO Mary OBrien to tell us more. Mary.
Thank you.
Mary, over to you.
My name is Mary O'Brien. I'm CEO and co-founder of VideoDoc. We provide convenient care online. So I'll just give you a quick background into how VideoDoc came about. I was working in the US 10 years ago, and I was living and working there. So every now and again, while I'm lucky I don't have to see a doctor often, every now and again I did need the services of a doctor. And what I found that it wasn't particularly convenient to access the doctor, but it was also expensive. And I was lucky enough to be placed on a consultancy project with the founding investor of MD Live, who are now one of the largest online doctor businesses in the US with 47 million subscribers. And I worked with Jim for 3 years. And I guess back in 2008, this would have been pre-iPhones. There wouldn't have been the same availability of mobile apps, obviously. So it was very much a hardware-focused company at the time. We used to place pods in pharmacies or hospitals and basically facilitate a FaceTime or a video conference with a doctor. And I came back to London, and what I realized when I came back to London was the NHS had their own problems. While it was free to see a doctor, you were waiting an average of 2 weeks to actually get that healthcare access, which obviously isn't convenient for anyone. And that's when I decided back in 2014 to set up VideoDoc. So we went about creating a business model which replicated what happens in general practice, which is basically setting up appointments on a 15-minute time slot. Launched that with a number of doctors, and after several months realized that that had a number of problems. The first one, the business model of by appointment in an online space didn't work for healthcare. Patients, so you'd have a patient come to the platform for the contraceptive pill. That appointment would take 9 minutes. The doctor had to sit there for 6 minutes before the next patient came. The next patient came along. They had a mental health issue, and their consultation time would take 25 to 30 minutes. So there was a knock-on effect of delays for the rest of the day. It was really difficult to scale. And I guess back at that time, we had built a web platform with no mobile front end, and it really wouldn't have scaled beyond a virtual clinic. And what we have 4 years later is very different to that starting point with VideoDoc. We now run a web portal and a mobile app, which is an on-demand access platform. And our route to market has been through partnerships, and we've been successful in Ireland and the UK with what we've secured to date. We have a contract with the largest employee benefit provider, who have 2.5 million patients, and we also secured a contract 3 years ago with the Irish government-owned insurer, offering 25% of the Irish population free online doctor visits. So our mission, vision, and what we want to do, our mission is to offer on-demand access to millions of patients, and we're already successfully doing that. But we want to do it in a way that's convenient, effective, affordable, and accessible for those patients. In terms of a vision, we want to deliver a company that's creating an amazing patient experience for patients everywhere. I think we're already doing it in that a lot of patients don't expect it to be so human. Patients come to the platform maybe for the first time, not necessarily understanding what an online doctor visit means, but actually they find it exceeds their expectations in terms of service. And we also recognize where we are from a platform perspective in the need for interoperability. So these platforms, if you're offering healthcare services at scale, don't work on their own. Healthcare today, I think that if you want to access a doctor visit, you don't necessarily enjoy the experience. There's a lot of hygiene factors that make that experience unenjoyable. The first being the opening hours of doctor surgeries. In the UK, they're 9 a.m. to 6 p.m. and doctors still take an hour for lunch. So if you're at work and you want to see a doctor, you've got to take a half day off. In the UK, there's 2.5 week wait times. So even if you want to see the doctor, you're waiting weeks. You've got to travel, obviously, to the surgery to attend that appointment. When you get there, you're sitting in a waiting room, perhaps catching other viruses from other patients while you're there. You have 7 minutes in front of the doctor, and then you might be interested to know there's 1 million doctor consultations every single day in the UK, but there's 200,000 people end up in hospital simply because they can't see a doctor. So there's huge potential for online doctor services. But don't worry, the future of healthcare is much better than that. VideoDoc is on demand, obviously online access. Our service is available at the moment 7 days a week from 8 a.m. to 10 p.m. and soon to be 24 hours. There's no wait times or travel times. You just have to have a mobile device, log in to see a doctor in minutes. The consultation itself, a lot of patients are surprised that it actually takes longer to see the doctor because our doctors give the patient time. They might not necessarily have access to the records, so they spend time giving the patient a thorough diagnosis and assessment. And at the end, every single patient using our platform has access to a free personal health record, of which we have millions set up for patients. So they can access their own notes, which doesn't necessarily happen in the government system at the moment, where you can go back and look at those notes after. So patients really enjoy having their personalized discharge notes and health records available to them at any time. Online healthcare, it's definitely growing. Deloitte produced a report in November last year to say that 22% of all interactions 65% of all interactions in healthcare will be online by 2022. The Minister of Health in the UK last week said that they expect the NHS will have 50% of all doctor consultations will be online in 10 years. And we're already seeing 25–30% growth month on month because the patient experience is so great. But if you look at some of the drivers for that growth, I think one of the main ones we see is there's no barriers to people actually accessing those consultations. The majority of us are lucky enough to have a mobile device and access to the internet, so there really is no reason why you can't log on and see a doctor. A lot of patients coming to our platform also have access to wearables or Bluetooth, blood pressure monitors, different devices that actually make their interaction with the doctor even more engaging because they can feed back their own stats and results. And one of the biggest drivers of growth for us is the fact that people want to access services online, they want to access on demand, and they're very used to subscriptions. So they can do all of that through VideoDoc, which isn't necessarily what you'd expect in healthcare. The trend for convenience, it's an obvious one. People don't want to travel and wait. But doctors want the convenience too. So when you're a GP or a family doctor, you don't necessarily have a lot of options in terms of a career path. You'll probably take a job or set up a surgery, and then you'll travel to work and work from 9 to 6. But actually, online healthcare gives you the option to work at any time that suits you, 24 hours a day, and you can log in from home. We'll have doctors log in when they're on holidays. You can do whatever suits you best from a convenience perspective. And then I guess from a health system side of things, doctors obviously are seeing aging populations. We're seeing more chronic disease management. So people using online services for acute care is definitely one of the reasons why these services are growing. VideoDoc, 65% of all of our patients complete a survey at the end of the consultation, and 98% of people rate the service as excellent or very good. Obviously, we deliver ongoing value, so we charge £20. There's no barriers to entry from an affordability perspective to use the service. We're on demand, which is something that patients want. Anytime, anywhere, it's a global service. You can access VideoDoc on our website or our mobile app. And currently, we've got 4 platforms, and we've got a number in deployment. So by September, we'll have 7 online services offered out through our partners. Our route to market is partnerships, but we do have 3 business models. Our first business model is SaaS, where we can roll out a branded web portal or mobile app for a partner in 6 to 8 weeks, giving them the option to offer online healthcare services to their own patients. We also have API integrations with some of our government partners, health insurers and hospitals. Consumers can use our service on a pay-as-you-go or per transaction basis, but our hope is that they will convert into subscribers in the immediate or longer term anyway. And that's where our focus on. It's subscriptions through government bodies, employee benefit providers, or partners who see the benefit in offering online doctor access to their staff or their members. With VideoDoc, there's no better benefit than health. Thank you.